Welcome, everyone. My name is Jeff Malmgren. Do we have the slide up? We do. Yeah, Manny, if we can, that's great. We have folks who have the Dari translation. There's a place to go. I hope you found that. This is a Doc Talk. Our subject today is understanding COVID-19 boosters. I think it will be a great conversation. I'm really glad to have you with us. We have a couple of great speakers, Dr. Baldev Sanghera and Dr. Lindsay Bowthorpe. I'll introduce them both in a moment, but I just wanted to cover off a couple of things. This is a presentation of Burnaby Primary Care Networks. It is being recorded. That's so you know about that, but also you'll be able to find the recording after the session at burnabypcn.ca. This and all of the other Doc Talks are also available on that site. So there's some great resource on that site if you'd like to take a look at it around the Doc Talks, but also around all of the different services that are available in Burnaby through the primary care networks and beyond. Just in terms of this session, it is a webinar. We're going to have a bit of a presentation from each of our presenters, but then we will have time for questions afterwards. In terms of putting the questions in, please put them in the Q&A box, and we will do our best to get to as many of those questions as we can. If we're unable to get to them, we will try to get answers back to you afterwards or post them on the burnabypcn.ca site, so you're aware of it. I do want to take a moment to thank and welcome Masood Rahmani from Mosaic, who's sharing his time from the Settlement and Family Services work to do the Dari translation today, which is always incredibly valuable for us. And again, we're lucky to have some great presenters today. Dr. Lindsay Bowthorpe is the Medical Officer and Medical Director from the Immunization Portfolio at the Fraser Health Authority. So it's really great to welcome Lindsay. And Dr. Baldev Sanghera is, for those of you who've been on DocTalks before, remember Dr. Sanghera. He's been a family physician in Burnaby for many years. He's the medical director at Prime Care Medical and at the Edmonds UPCC, but he's also a leader in the community. He's was a founding member of Burnaby Division. He sits on the Burnaby the Primary Care Network Steering Committee, and he also sits on the General Practitioner Services the General Practitioner Services Committee, where he's a leader at a provincial level. So I'd like to welcome them both, and without further ado, I'll turn it over to Dr. Sanghera.
Thank you, Jeff. So welcome everybody to our discussion about the vaccine boosters. And if I can get the slides up. So for those folks who are still quite unaware of what COVID-19 is, we've been living with a virus infecting around the whole world. And it is a type of coronavirus which is related to coronaviruses, are a family of viruses that are related to influenza viruses and other respiratory infection viruses. These viruses are spread through the air, and by droplets when we cough or sneeze, they can come out of our mouth and disperse into the air onto our hands. And when we touch things with our hands, we can spread the virus that way, plus it can just float through the air on a long-term basis. Go to the next slide. And this particular type of virus is actually different from influenza virus in that this one has been known to cause not just respiratory infections, but also it can cause organ inflammation, and the organs being the different organs that run our body, our blood vessels, etc. And so wherever the virus goes, it will cause inflammation. So if it goes into the lungs, it can cause a pneumonia. If it goes into the brain, it can give you a bit of a brain fog. If it goes into the heart, it can cause inflammation in the heart, which makes you feel tired with shorter breath, and even can trigger heart attacks. This virus spread around the world has had approximately a 2% death rate in the early parts of the pandemic. And since the last year and a half, we have been giving vaccinations, the death rate has actually decreased to about 1%. 30% of people that have had COVID-19 have ended up having long-term symptoms. And everybody in this whole world has been impacted by the COVID infection in one way or another. Either you had the infection or you were having to deal with the restrictions. Next slide. So around the world, we have seen so far, since when COVID-19 was first identified at the end of 2019, we have seen a total of 243 million cases around the world, and out of which almost 5 million people have died. And but we are now starting to fight back and give people protection. We have distributed 1.35 billion doses of the vaccine around the world, so that's a lot of vaccines. And in Canada itself, we've had a total of 1.7 million total cases, of which there's a deaths since the pandemic is about, I think it's up to about 45 million now. If we go on to the next slide, that should give us a better picture. Yeah, so we've had a lot of vaccine has been given. 8.1 million doses of vaccine have been given here in BC, and the infection's actually been impacting a lot of different people, especially people in lower socioeconomic groups, people that live in larger groups, larger families, people that work in factories or places of work like warehouses where they're exposed to a lot of other people. Next slide. So in this time of year, we're seeing that there's going to be a lot of infections occurring. COVID-19 is one virus that's circulating. We're also seeing influenza virus circulating. And in the last 2 to 3 weeks, we have seen a lot more people coming into our offices and into emergency rooms feeling sick. And also we've been dealing with the cold viruses as well since schools reopened again. Sometimes it's difficult to tell which infection that you have. And unfortunately, our rapid test kits are often not accurate enough to pick up the COVID virus in the first few days of your infection. So what you want to understand is you could have a fever with COVID or flu. You could have fatigue more likely to be with the flu, but can also occur with COVID and also with the cold virus. You will have a cough, usually a dry cough in COVID, and as well as in influenza. When you get a cold virus, typically you may have more sneezing, or you may have allergy symptoms that give you similar congestion and sneezing. Body aches and pains are more common with people getting the cold virus and with the influenza virus. Common to get runny noses or stuffy noses with the cold and flu viruses. Sore throat is common, more so in cold viruses, but can also be seen in the other two. And often you can see diarrhea in patients, younger patients especially, if they get the flu. And also now with this new variant of the COVID virus that we're seeing, the B45 variant, typically has been causing more stomach upset. So which has been a bit of a problem. The various different viruses cause all of these symptoms. It makes it difficult for us to figure out which one that we're dealing with. But, best way to look at this is you have an infection that is contagious and you can spread it to other people. So if you have these symptoms, ideally what you want to do is rest, stay home, and hydrate yourself, control the symptoms. If you have a fever, use some Tylenol. And for all of the other things, it's the good old things that we used to do. We're maintaining our hydration, fluids, soup, simple foods. If, however, you have other conditions that you have chronic disease, diabetes, heart disease, or asthma, COPD, or any times that you start to get short of breath or you have chest pain, you need to be assessed and you need to go see your family doctor or go to the urgent care center. Ideally, I would recommend that you try to do a COVID rapid test at home first, just to see if that is what you have to deal with. But you may need to repeat it every day or every second day for at least 5 days in order for the rapid test kit to show positive. And this is from the onset of your symptoms. Next slide. The people that are at the highest risk are people that are elderly, they're Indigenous, marginalized, which means that they have other risk factors and then they may not have all the supports that they need. People that are racial minorities, simply because of the type of work that they may do or how they live, where they live, living in larger families. People that have chronic disease, as I mentioned earlier, and as well as those folks that are immunocompromised. And immunocompromised means where your immune system is weak. Usually that may be associated with people that have chronic disease or cancer, or sometimes even the treatments that we give for certain conditions like cancer or arthritis. So that can put you at higher risk, and the risk there is that you may end up having more shortness of breath, more difficulty managing your symptoms, and require a trip to the emergency room. In these groups, when they get infection, so it's easier for them to get the infection, but at the same time, they are at higher risk of getting illness of a higher severity, so meaning more symptoms. 80% of the deaths that we've seen so far in Canada from COVID-19 have been in adults above the age of 65 because of the risks that they have been exposed to and their own personal factors. Approximately, initially in the first part of the pandemic, about 30% of people were presenting with what we call long COVID symptoms. These are symptoms that are present for 3 months or longer, and they can be respiratory symptoms like cough or shortness of breath, general weakness, brain fog, where you're not able to focus or concentrate properly, or you may have difficulty remembering small little things. Poor circulation, increased anxiety. That 30% has now started to decrease, and we're seeing less incidence of that, about 15% nowadays. And we think that the reason is that a lot of people have received vaccine, and that has been a protective factor, not only protecting people against death, but also severity of illness, as well as the risk for long COVID symptoms. The big risks right now in this fall and winter coming forward are that there are new variants of this COVID virus emerging, and they appear to be more infectious and more easily spread. Next slide. So how do we protect ourselves? Wear a mask, avoid large crowds, and especially if there's large crowds or in poorly ventilated spaces. Wash your hands, and please get vaccinated. We all know that the best way to avoid getting ill is preventing it right at the outset. So wearing a mask creates a barrier. You're not going to pick up other people's bugs. And if you're sick, you won't be passing it on to other people. And the vaccinations, the different vaccines that we have all allow your immune system to recognize these viruses that are attacking our bodies and fight them as soon as the infection starts. So it doesn't completely prevent the infection from spreading, but your body has a better chance at fighting it off quicker, so you end up with fewer symptoms. Next slide. The vaccines will give us an opportunity to protect our high-risk groups from death in hospitals. And even children, they're low risk generally, but there's a small risk of acquiring a syndrome called multi-organ inflammatory syndrome. And that syndrome can be quite severe, and it can cause hospitalization. Currently, in the last 2 years, we've had about 400 cases in Canada. So not a big number, but we want to avoid as many of these severe cases as possible. And we've also started to notice as people have been kind of shying away from getting vaccinated, even childhood vaccines, we're starting to see a return of polio risk in some places. We've now found polio virus in the wastewater in New York. So it's not that, we need to continue to have a focus on generally using all of the vaccines that we have been using in the past. When I was a child, I remember there was a very high uptake of vaccines, and approximately 90% of children would have been vaccinated back then. Currently, here in BC, and Dr. Bowthorpe may be able to give us a little bit more of a picture on how the rates are, but the rates are much lower. Closer to 60 to 70% of children are fully vaccinated with their regular childhood vaccine. So it puts them back at risk of catching all of these other illnesses. And vaccines have been proven to be safe. Next slide. Vaccines have been proven to be safe generally. There is some common side effects that we do see, and typically there will be wherever you have the injection in your shoulder. There will be soreness for 24 to 48 hours. You might feel general muscle pain, a little bit of tiredness and fatigue as your immune system is getting all geared up and boosted up. Some people actually feel fever, similar to what you might feel if you were sick, but that's just your immune system gearing up, and it's part of the immune response. Along with that, sometimes it can cause congestion or diarrhea. These things are relatively common, but they pass, and it usually takes a day or so for that to happen. Ideally, what you want to do is, if you get these symptoms, check with your family doctor, see if there's anything of concern, or your nurse practitioner. And ideally, what they'll probably end up telling you is to monitor your symptoms, take some Tylenol, hydrate yourself, and rest. And again, 1 to 2 days later, everything goes away. Next slide. The current vaccines that are available for us to think about, for COVID specifically, you will be you have an availability for the current vaccine being provided is a bivalent vaccine. Both Moderna and Pfizer companies provide this bivalent vaccine, and what that bivalent means is that there are two virus strains that we're covering. The one part, it will cover all of the earlier variants like alpha, beta, delta variants that we dealt with in 2020 and 2021. And currently we've been dealing with Omicron variants. And so there's a second component in these two vaccines that will help to fight off the B1, 2, B4, and B5 COVID variants. The Moderna vaccine has been approved for use in people 18 years and older, and the Pfizer one has been approved for use in 12 and up. The regular Pfizer vaccine has been approved for children 6 months and up as well. So we can provide a lot of protection to a variety of different people. The pharmacist that gives you the vaccine will be able to identify which one is the best one for you and offer that. At the same time, we should also be thinking about other vaccines that are available to help protect you and to also protect our healthcare system, because if too many people get sick, we're going to overwhelm our doctor's offices, our emergency rooms, our urgent care centers, and that will prevent other people that get other illnesses from being seen. So the other vaccines that we should be considering at this particular time include the influenza vaccines, which names that you may hear are Flu Mist, which is the nasal spray for children under the age of 18, Fluzone, which is the one that we're using for predominantly everybody. For seniors, there are the Fluzone high dose or the Fluad high dose. We should be thinking about vaccines for pneumonia if you're 65 and over or have other risk factors that make your immune system a little bit weaker. The two pneumonia vaccines that are available currently, Pneumovax is covered by MSP, by your healthcare system, and the other option is Prevnar, And people that have weaker immune systems or are much higher risk, I would recommend you get both of them. Prevnar, unfortunately, is not covered by the public system, and you would have to pay for that. Other illnesses that are sometimes worrisome for people, and they ask questions about shingles, which is you get a bumpy rash, which is very painful in a particular body part. Stems from having had exposure to the chickenpox virus when you were a child. And there is a vaccine called Shingrix now that's all available to prevent that coming out as an adult. Usually it's more painful after the age of 65, and it's a 2-dose series. And I would highly recommend, if you're in that age group, think about it and get that. And again, just a message about making sure that all of our children are fully vaccinated with all of their childhood vaccines. Next slide. So sometimes I get asked a lot of questions about things that people are afraid of. And so the COVID vaccines, there's a few things that I want to be very clear about. Lots of studies have been done and to prove that these myths are not true. COVID vaccines do not cause long-term menstrual or hormonal problems. After any vaccination, as your immune system gears up, women who are menstruating or in the age of menstruation, they may notice that their menstrual cycles are slightly off for a few months, and then they go back to normal. That's just the way that the immune system works in conjunction with our hormones. But it's a temporary problem, which does resolve. COVID vaccines do not cause infertility. In fact, they're been proven to be very, very safe during pregnancy, and would actually help boost the unborn child's immune system as well in the uterus. So as they're developing some antibodies, and they're born with protection. The COVID vaccines do not weaken the immune system; they strengthen your immune system. Other things that I've heard people ask me or tell me is that vaccinations are a way of population control. COVID vaccines do not contain a poison to kill people. They're here to protect us. They do not contain microchips, so nobody's going to be able to control you, and they do not cause the virus to spread. Now, sometimes folks have been telling me that they just want to wait and see before they get the vaccine, and my answer to that statement will be: vaccines are not 100% effective, but they're 99.99% effective and safe. And over the 2 to 2.5 years that we've seen this COVID virus circulating around the world, we have actually seen a dramatic drop off in the number of people dying from COVID. We've also seen a decrease in the number of people that are actually getting sick enough to require hospitalization. So, but we need to keep up with the different variants that come. So each time a new variant shows up, we have to treat it like a new virus, and we need to get another vaccination to fight that one off. Next slide. So my advice to all of you is that the benefits of the vaccines far outweigh the risks to the majority of people. Unless you're specifically allergic to a component of the vaccine, I would recommend that everybody get them. The risk of it being infected with COVID-19, being hospitalized, and dying far outweighs any risk of even the rare side effects. Please get your shot and accept whichever Canadian approved vaccine is offered based on your risk, your age group, and let's focus on staying healthy. Next slide. And the best way to get vaccinated is wait for your notification by email or by text. And then once you get that, call the Get Vaccinated phone line, which is 1-833-838-2323. And then you can select which language that you wish to converse with by pushing 1, 2, 3, 4, or 5. There's a whole host of multiple languages that can be translated there. The Get Vaccinated website also is available, and there are ways to get that translated immediately by selecting on the page. COVID vaccines are available at most pharmacies, and influenza vaccines are available either at your family doctor office or at the pharmacy. Thank you.
Thanks, Dr. Sanghera. That was wonderful. So we do have some questions that are coming up, and we'll get to those at the end of all the presentations. So I'll actually just easily turn it over to Dr. Bowthorpe.
Hi, everyone, and thank you, Dr. Sanghera, for the great overview and the beginning. And I'm happy to go second. A few of my slides may echo some of the conversation from Dr. Sanghera, but thank you, Manny, for getting the slides up, and then I'll start shortly. Okay, please, the next slide. And before I start my presentation, wanted to acknowledge that Fraser Health does provide services within the unceded and traditional lands of the Coast Salish and the Inkla nations, and it's home to 6 Métis charter communities. And next slide, please. And so Dr. Sanghera has given a great overview in terms of some of the different respiratory bugs that are out there, and wanted to give a little bit of context with regards to when we've seen COVID-19 cases rise in the past, as well as influenza or flu. And in Canada, typically the season that we're going to have those coughs and colds is in the fall and in the winter. And for flu particularly, roughly between November and April is when we see the rise in cases. And last year, for COVID-19, we did see some cases in the late summer to early November. And then Omicron really led to a sharp rise in December and January of 2022. And as outlined, it is a more contagious strain of COVID-19. And if you can go to the next slide. And really just echoing the sentiment that using good practices in terms of washing your hands, staying home if you're feeling unwell, and also really looking at masks and the vaccinations that are available to you. Next slide, please. From a public health lens, so when I'm thinking of the entire population, not just an individual patient that I'm speaking with, it's really important to get vaccinated, not only to protect yourself, but to also protect the ones around you. So your family, your friends, your community, but also making sure that our hospitals have capacity, that by getting vaccinated, we're decreasing the risk of spreading the bug to someone else, and so decreasing the risk of someone ending up in hospital with complications from a respiratory condition, as well as ensuring that our schools and workplaces have people that are well and can continue to go to work and school. Next slide. And COVID-19, influenza, and pneumococcal or pneumovax were the ones that I wanted to speak about. As Dr. Sanghera has pointed out, Prevnar 13, which is another pneumococcal vaccine, isn't covered. And really the pneumococcal vaccines are to protect you against pneumonia, so a lung infection. Next slide. And for COVID-19 and influenza, really want to encourage everybody who's 6 months of age and older, they are eligible for COVID-19 and flu. Influenza is a yearly vaccine, and we are having our annual flu vaccinations right now. And COVID-19, we are in the process of having the booster doses come out to provide an added protection this year and before we get into respiratory season. As well, in the late summer, August, September, we did start to vaccinate children as young as 6 months against COVID-19. And so we now have a large percentage of our population, almost everyone who is eligible to have a COVID-19 vaccine. In terms of what is provincially funded for getting pneumovax or the pneumococcal vaccine, it is individuals who are 65 years of age and older. people experiencing homelessness, as well as individuals who use drugs. I would recommend, if you had any questions or wanted to know more about the pneumovax vaccine, and if you are eligible, because there are some other indications as well, that you speak with your primary care provider. Another great resource that is only available in English, unfortunately, but that does have a lot of information on all three of these vaccines and also illnesses, is immunizebc.ca. Next slide. I wanted to highlight for people who I'd really want to encourage, if you don't typically or normally get your flu vaccine, that I would really recommend do this year, as well as if you haven't had a COVID-19 vaccine. And the reason why is these are the people who we are most concerned about of having complications, so getting really sick, potentially being hospitalized for an infection of their lungs, for instance. And so with flu, we are concerned about young kids, kids under the age of 5, also people who are pregnant, as well as their unborn child, the risks to them if they contract flu. Also individuals who are older, and those may be people who live in long-term care, but they might also be younger individuals who live in a group home, for instance, and some people who do have some chronic health concerns, such as chronic heart or lung conditions, as well as individuals that work with these populations that are at higher risk. For instance, healthcare workers, and really encourage them to get vaccinated, both to protect themselves and to protect the people that they work with. As well as COVID-19, individuals that I'd really like to encourage to get vaccinated are those who have never had a COVID-19 vaccine. A COVID-19 vaccine will give you longer lasting and better protection from COVID-19 in the future than solely relying on COVID-19 infection, as well as individuals who did not get a booster dose previously, so did not have a third dose after their first 2 doses of the COVID vaccine. Really encourage them to get a vaccine this year to help give your body a chance to really be at its best if it comes into contact with COVID-19. And lastly, those who immune system is weaker, those who are more at risk of getting sick, would really recommend that they also get their booster when they are eligible. Next slide. A lot of people also ask, can you get more than one vaccine at an appointment? And I think this is coming up this year, because typically people get their flu shot as a single vaccine in the fall, whereas now people are able to get their COVID as well as their flu shot at the same time. And some people also pneumovax, and really wanted to say to everyone, or to reassure them, that this is very common to get more than one vaccine at a time. We do this routinely when we vaccinate young kids as well as school age kids. So this is something that is safe, it is effective, and that if it works best for you to get all the vaccines at once, you are safe to do so. Some people do choose to get the vaccines separately, and that's also a personal preference. Next slide. We also have people who are scared of needles, or who get very anxious before they go and get a vaccine. And there's been a system that was developed recently. It's called CARD, to help particularly kids get ready and be able to go and get a vaccine and feel very good or confident about that process. And what CARD stands for is comfort, ask, relax, distract. And by comfort, that could be something such as their parent goes with them so that they feel comfortable when they're going to get their vaccine. Ask means that they can ask their parent or ask the healthcare provider that's giving them the vaccine any questions that they might have. In terms of relaxing, that might mean some deep breathing, taking a few moments by themselves before they get the vaccine. And then also in terms of distraction, that could mean that they are watching a video, that they're talking with their parent or doing something else, so they're not watching as the needle is given to them. And again, this is available on the immunizebc.ca website. And if you search for the title of this slide, so how to reduce pain, stress, and anxiety with vaccinations, you can find out more information about this system. Next slide. Dr. Sanghera outlined all the places that you can get vaccinated. I will also say another one is the neighborhood immunization clinic, which is at the Bonser site. And public health is more for the really young kids, for those under 5. Next slide. And the Get Vaccinated system. And you can also check with your primary care provider, your family physician, to see if they are offering the flu vaccine this year. Next slide. The reason that I wanted to put this was just, this is the page that you will see after you get your COVID-19 vaccine. When I got my COVID and my flu shot a few weeks ago, they sent you an aftercare sheet, and it just nicely outlines some of the symptoms that you may experience, but they are typically very short-lived. And as Dr. Sanghera mentioned, you can always follow up with your primary care provider if you have any concerns or questions. Next slide. And as mentioned, we do have the Moderna and Pfizer. There's quite a few different vaccines based on your age, if you have a weakened immune system, and also whether it's the first time you're getting a COVID-19 vaccine or if it is a booster dose. And the nice thing about the bivalent vaccine is that it is updated in that it is helping your body to respond to the Omicron strain, helping your body to create antibodies to Omicron, and antibodies are one of the ways that your immune system works to fend off infections. Next slide. I also wanted to highlight that there's a lot of background work that happens with vaccines. And before any vaccine is allowed to be used in Canada, it is really intensely looked at. Health Canada does a big review of it, or of any vaccine that's submitted to be used in Canada, to see if it is safe, and also if it works. So does it actually decrease the risk of getting the disease that it is immunizing you against? And so that is one process that happens. The second really is that there's a lot that goes on after a vaccine comes into Canada and is started to be used. We do continually monitor to see if there are any concerns for safety with a vaccine that is being used. And one of the ways that that happens is that after someone gets a vaccine, if they experience an event that is severe, or also if it's unexpected after they get vaccinated, that could be something that we would follow up on. I'd recommend that you talk with your healthcare provider if you're having any symptoms after getting vaccinated that you are concerned about, and they may create a report that's called an adverse event following immunization. That just means essentially that the local medical health officer, as well as nurses, will do an investigation to learn more about what your symptoms are, and will make a recommendation to you for future vaccinations if anything needs to be different. And I will also highlight, though, just because something happens after you get vaccinated doesn't mean that the vaccine itself caused that event. But what this allows us to do is that we can monitor to see if there is any concern for a safety signal. So are we seeing any potential side effects or events that happen after vaccination that we need to investigate and look into? Next slide. And I know we're nearing the end and you want to get to questions, so I will go through these slides a bit more quickly. And this is really to highlight not just what we're offering now in terms of flu and COVID and pneumovax, but really that we want people to be up to date on all of their vaccines, meaning the vaccines that they can get and are eligible for, that they are up to date to protect themselves and their community. Next slide. Oh, thanks, Manny. So essentially really to say that vaccines do save lives. For instance, some of the vaccines that we give in childhood decrease the risk of bacterial meningitis, meningitis being an inflammation of part of your brain that can be life-threatening, as well as really to highlight that some of those vaccine preventable diseases are still out there. There was mention of polio. There's also measles, which is a concern. And also if we have less of these diseases circulating or around in our community, there's less chance of having antibiotics or drugs needed to be used to treat the infection, as well as decreasing the risk of antibiotic resistance. Next slide. Next slide again. Wanted to let you know, if you aren't aware of what the schedule is for people to get vaccinated. So our infants and young kids do get quite a few vaccines, and you can call public health to book an appointment for your child to get these vaccines. In Burnaby, it is a bit of a moving target, but currently when we look at coverage for our 2-year-olds, it's about 64% are up to date, meaning that about 64% of kids have had all the vaccines that they should get before they're 2 years old. Next slide. And for our teenagers, we do go into schools as public health and immunize in grade 6 and grade 9. There are vaccines that are given at those ages, but we do also try and catch up kids on any vaccines that they have missed. But we don't offer COVID-19 or flu in these clinics, and that is based on the fact that it's also the time of year, but the fact that we're not seeing all the kids in the school. It's only the grade 6s and the grade 9s that we are immunizing. Next slide. I really do like the Immunize BC website. I took a screenshot. I know it's not the prettiest slide, but just to give you an idea of all the things that you can look up on this website. And the FAQ section is really good in terms of it was built on a lot of questions that people had and submitted, and that they do have answers available to you, and it is updated regularly, and there is information on COVID-19. Next slide. Lastly, a few other websites that may be of interest to you is iboostimmunity.ca, our Fraser Health website, as well as the BC Centre for Disease Control, where you can learn more about COVID-19 and all the other vaccines. And that's everything for me.
Great. Thanks, Dr. Bowthorpe. That was great. Lots of information in there from both of our presenters. Really, and we do have a number of questions. So I don't want to say, because we don't have too much time left, I kind of want to dive into them. But I will say, one of the things that keeps coming up around this round is that folks, there's resistance. There seems to be resistance for even, you know, as I look back on the 2 years, we had folks who resisted the vaccines to begin with. And that was one group of folks, but now we seem to have a sort of a general resistance to getting that last booster. In fact, we were talking with the folks from Home Health, and some of the seniors at home are just, they don't want to get it. They're feeling as if this is they've heard this story before, and also I guess there's a question: is this something that we need to accept as part of our life going forward? Is this no longer? Are we no longer? Do folks no longer need to look at it as something as episodic? That's something that we may need to be part of our life as far as for a long time to come. Do you think this looks like? I'm just asking you if you think this looks like it may be a regular vaccination that we get for COVID for the foreseeable future.
Who would you like to take the
Either one,
question?
either or both can answer that question.
I can start. I'm happy to. I think that's the $1,000,000 question, the crystal ball. We do know that influenza or flu, which is another virus, we do have an annual flu shot. So it is given every year. And that's because the virus does change from year to year. And we do update the vaccine to try and be as current with what is in our community in terms of the strains to offer the best protection against the flu that season. I think it's still going to take a little bit of time to see how often do we need to get the COVID-19 vaccine. We are also seeing COVID-19, what it was like when the original strain was here versus how it is now. It has changed. So I think that's an evolving question, and it'll likely be with us for a while in terms of how frequent will we need to get a vaccine. I think that's still to be determined.
So I can add to that, and great answer there, Dr. Bowthorpe. What I would suggest is that we as a community need to think about what Dr. Bowthorpe had said earlier, is that we protect ourselves and we protect the people around us, protect our community. We prevent the spread. As viruses spread, they change, they mutate. And the more times that they spread, the more mutations that we have. And more mutations means more variants that, again, can keep infecting us. And that sets us up into the situation of, yes, we will need to have repeated vaccinations, maybe on an annual basis, maybe more frequently. Right now, one of the questions is asking how long should we wait between boosters? And the timeline there right now, the recommended time between boosters, because of the development of the variants, is about 6 months. And you know, it's important to understand that we need to stay on top of preventing the spread, and the vaccines help to do that. But we need to do what we can. We need to mask up. We need to wash our hands. We need to stay home when we're sick. We don't need to go to work or go to school sick.
So I've a follow-up question on variants on that. But while you were on the booster question, one of the questions has been, I think you may have touched on it, but if you could answer it again, how long after having been infected with COVID should I wait till I get my booster? If given that I say I get COVID 3 months after I get my last booster, and I'm now 3 months later, should I wait longer, or what's that gap?
So when you get infected, your body's immune system kicks in, and it creates the antibodies to fight off the infection. And after an infection, what we have found so far, that you're relatively well protected with the antibody levels for about 3 months. And so wait the 3 months before you get your next booster, if you're eligible to get that. And I think I wouldn't recommend, like, if you just recovered from the infection, I wouldn't rush off and get the booster right away. Wait a 3 month minimum.
3 months. It's interesting. I mean, I do want to ask about variants. I mean, you spoke to the variants that the variants that we see, seem to be more easily spread, at least, if not more virulent. Are we? If you look at the broader data, are we seeing? Is the list of variants continuing to grow as fast as quickly as it did before?
Dr. Bowthorpe.
Oh, you want to see the pretty graphs that I sometimes get to see from the BC CDC, it sounds like. I think it's interesting to see where are we, and that we're still in Omicron as the variant. People probably remember Alpha, Beta, Gamma, I believe, Delta, as other variants. And so it really depends in terms of how quickly things are changing. I do know that they are keeping an eye on it. There's a few different things happening around the world, but here in Canada, in BC, we are still with Omicron predominantly.
Mm-hmm. Mm-hmm. So we're not seeing the rise in some of those other variants have shown in some of the vulnerable communities around the world.
we're keeping an eye on what they are testing at the BC CDC.
Mhm. Great. Thank you. In terms of, there was a question around booster shots, and I think this folks always ask this. I mean, it used to be that you had no choice. You got the one that they gave you when you walked into the door. Now you may have a little more flexibility, or you may not. Is there any concern around, because we're talking about bivalent and we're talking about all these different mixes, is there any concern around having had multiple different boosters or vaccines? Is that an issue, or is it even desirable?
If I'm understanding the question correctly, I think there's a few parts. So between the Moderna bivalent, which was approved for use in Canada first because it went through all those regulatory processes first with Health Canada, is authorized for 18 and above, whereas Pfizer is authorized for 12 years of age and older. And really that has to do with the studies that were done when they made their submissions to Health Canada to get the vaccine approved for use in Canada. Between Moderna and Pfizer, if you are eligible for the bivalent, both are great options. I don't have a preference from one or the other. If someone is immune compromised, often we do recommend Moderna over Pfizer because it's a higher dose, so it should help to stimulate the immune system better. And also in terms of when we look at all the other vaccines that we give, there is more than one company that makes the vaccine. So necessarily, like when you start getting hepatitis B vaccines, you might get one product, and then the second one may be a different company that made the vaccine. So all that to say that it can be good in that if you have the Moderna and the Pfizer, they're similar but a little different. So it could help to stimulate your immune system if you had a combination of the two, but either works, Pfizer or Moderna.
Are there any non-mRNA options out there for the boosters?
I was wondering if I would get that question, in that in terms of effectiveness, we really do go to the mRNA vaccine, so Moderna and Pfizer. For the non-mRNA vaccines, I believe we do still have some in terms of how much. I think that would be something that you would have to check with the Get Vaccinated system when you are booking your appointment. Great,
thank you. There's this is a technical one. There was someone was saying that the information that Dr. Bowthorpe that you put forward around the reactions after the vaccine, not all pharmacies were necessarily giving that out. So if you could give any kind of link to that information, that would be great. And yeah, that would be wonderful. And we can provide that later. It would be great. Is there any, one of the things that has come up around the reactions to vaccines, is there ever a delayed reaction? We've had some folks had some questions about that. Maybe Dr. Sanghera, do reactions come within the next day, or they're not a reaction, or is there a...
Most of all of the common reactions and side effects that we typically see in patients usually happen within the first 48 hours.
Yeah.
Some of the more rare things that are out there have appeared sometimes a week or two later.
Right.
And as Dr. Bowthorpe mentioned, sometimes things just by circumstance happen, and they're not related to the vaccine. It's just coincidence.
And I think we just got maybe one more question, but you had mentioned some percentages around long COVID. We're learning more about if you could repeat those percentages, that would be great, but also we're learning more about it. Can kind of just, what does it mean for folks who have long COVID now? Or do we have a feel for a path for those folks?
So the data that I had presented indicated that in the first year to 2 years of the pandemic, before a lot of the folks were being vaccinated, the incidence of long COVID that we were seeing was about 30% of the people getting infected. And long COVID is those symptoms of fatigue, brain fog, dry cough, just lingering for longer than 3 months. And now, after a lot of people have been vaccinated, and in Canada, we've been lucky to have high vaccination rates with the first and second shots, and not as high with the third and fourth shots, but we're slowly getting there now. The incidence of the long COVID has actually dropped from about 30% down to 15%. And the hope is that with continued vaccination against the various different variants that pop up, we can keep that incidence of long COVID down to a minimum.
Mm-hmm. And is there are there treatments coming forward for folks who have long COVID?
So COVID is a new infection. We haven't really dealt with this since before the pandemic, and we're learning on the fly as we go. Lots of research is being done, but I personally don't know of any specific treatments for long COVID other than continuing to support the body and the various different systems within our bodies to allow it to recover.
Great. Well, that's all we have time for. And there are a couple of questions. We'll make sure we answer them later when we post on site. I do, again, really want to thank both Dr. Bowthorpe and Dr. Sanghera for their presentation and their time today. It was tremendously valuable for me, and I hope it was valuable for you, for the folks who've come along. A reminder that this will be posted. It's recorded, and it will be posted on the BurnabyPCN.ca website. And if you have further questions, you can use the registration link that you had and send us further questions, and we'll endeavor to make sure that those get answered. And with that, I'll leave you to what may be the last sunny Friday afternoon we have in 2022. So have a great week, a great weekend, everybody. Thanks again.
Bye, everyone.
Bye.